Great. My name is Melanie Gertis. I'm the licensed counselor for Victoria College, and we have Samuel from Midcoast Family Services here for your presentation on prescription drugs.
All right, thank you, Melanie. First of all, thank you to UHV for allowing us to be here, and thank you for Melanie for having us
Victoria
here.
College.
Victoria College, I'm sorry, I'm getting way ahead of myself. I'm talking about the 4-year degree, not the 2-year degree. All right, so welcome to my office, AKA my kitchen. So please disregard the chef that's hovering over my head. No, you're not taking any hallucinogens. It is a chef hanging out over my head. All right, so the topic for today is pick your poison. We're going to be discussing mixing alcohol and prescription drugs and the prevalence in college age students. My name is Samuel Villa. I'm a prevention specialist for Midcoast Family Services. And we do provide these services to Victoria College and UHV, as well as the outlying school districts in the county, as well as Victoria County. And so let me go ahead and proceed. The objective of this presentation is simply to inform you about the dangers of mixing alcohol and prescription drugs. Midcoast Family Services, nor myself, hold no judgment on those who do mix alcohol and prescription drugs. However, if you do recognize that you do have a problem, we ask that you please seek some assistance. All right, so the two main differences that we're going to be discussing today is the difference between using and abusing. Using prescription drugs as using prescription drugs as directed. Naturally, the misuse or the non-medical use is taking medications other than what is its intended use, such as taking over-the-counter medications or prescription drugs that are not for its intention, taking medications that don't belong to you, and taking medications for the sole reason of being intoxicated. Now, alcohol can be mixed with several different types of medications, but the main culprits are opioids, depressants, and stimulants. In 2019, an article in the Corpus Christi Caller-Times stated that on the campus of Texas A&M Corpus Christi, 77% of students were on some type of stimulant, depressant, or opioid. 45% misused prescription drugs and alcohol at least one time. 23% mixed alcohol and prescription drugs. But the fact remains that the majority of college students are safely using prescription drugs. However, they are at high risk of misusing prescription drugs. And naturally, this survey occurred in 2019. With the advent of COVID, I'm willing to bet that the numbers have increased a little. All right, so let's talk about alcohol. Alcohol is a depressant. For better or worse, its overall function of alcohol is to inhibit brain activity. Intoxication, even in ancient times, was prevalently used. In ancient times, people drank alcohol to expand their mind, often used alcohol in religious ceremonies prior to going into battle and or taking an oath of allegiance. The information, one of the side effects of using alcohol is the delayed rate of information slowly going to the brain. This results in slurred speech and overall impaired coordination. Some toxic events include irregular heartbeat, decreased breathing, as well as loss of memory. Now let's talk about stimulants. It affects the central nervous system, which trigger the fight or flight system in the brain. Some side effects include increased heart rate, irritability, and anxiety. It's used to treat ADHD, depression, attention deficit disorder, and narcolepsy. among other things. Examples of stimulants are your Vyvanse, Ritalin, Concerta, Adderall, etc. Stimulants are more abused than any other prescription drug. They can be crushed and snorted or even smoked. And other stimulants, illicit stimulants, can be ecstasy and cocaine. Opioids. Opioids can be very addicting, mainly because it rewires the brain to have a different baseline. Opioids are a pain blocker. It decreases the heart rate, and side effects include nausea and constipation. It decreases the heart rate to the point where you can suffer a heart attack. Some of the examples of opioids are Oxycontin and Vicodin, codeine, morphine, heroin, Percocet, and methadone. Now, when we talk about depressants, alcohol is also a depressant. So naturally, if you mix a depressant with a depressant, it severely inhibits brain activity. It helps relax, used to treat anxiety, and the toxic side effects include decreased heart rate, uh, slow breathing to the point of unconsciousness. Examples of depressants are benzos, Xanax, and Ambien. Mixed with alcohol, drugs can be short term, in the short term can provide moments of euphoria, followed by toxic side effects. Mixing alcohol with a depressant will intensify effects of medication. Some might think it's okay to drink alcohol if taking a stimulant, since it evens it out. However, this is not the case. Mixing stimulants with alcohol can overrun or hide the depressing effects of alcohol. So they will feel less drunk than they actually are, which leads to heavy drinking, which leads to eventually alcohol poisoning. Also, high blood pressure, disturbed sleep, anxiety, drowsiness, sometimes at the same time, and and also uh, can deal with a racing heart. Now, if you're drowsy and having a rapid heartbeat at the same time, oftentimes leads to some patients thinking they might be having a heart attack or a panic attack. And combining alcohol with opioids, it adversely affects the central nervous system, which is the brain, the spinal cord, and nerves. When basically it slows everything down. The way I explain to my middle school and high school students when combining alcohol with opioids, it's like driving and you're running out of gas. Eventually, everything just stops. And when we're dealing with our bodies, the same things happen. Everything just stops, including your breathing and including your heart. Combining depressants uh, with a depressant, combining a depressant with alcohol results in a deep state of relaxation. Ways to be safe so this doesn't occur in your own home. Just take medication that's as directed. Don't take any meds that don't belong to you. And lock medication when they're not being used in a safe place, and properly disposed when they are no longer needed. Right. I know the last time I did a presentation, there were a lot of questions. And so at this time, I'll go ahead and stop and ask if there are any questions at this time. No questions? All right, great. Well, this took a lot shorter than what I thought it was going to be. I was anticipating a lot of questions. But if you can think of anything or comments or anything that you'd like to discuss at this time, I'll be more than willing to discuss with you.
I have a question.
Go right ahead.
What are ways to properly dispose the drugs, medication?
Okay. Well, some of the things that I've discussed with the sheriff's department about this And I think the sheriff's department routinely, I want to say monthly, uh, they do have a program where you can drop off medication at the sheriff's department. I know some of the pharmacies uh, have some drop-off boxes where you can dispose of some medications. If you don't want to deal with all that, one of the things that we've heard that you can do is to put medication in coffee grounds and put them in either a plastic bag or a paper bag and just dispose of it in your trash can. Uh, what you don't want to do is flush them down the toilet or pour them down the sink. Uh, that can have adverse effects to not only the water, but also wildlife that do drink from our rivers and lakes and stuff.
Questions can go in the chat, or you can unmute yourself, whichever you feel comfortable with.
If there's anything that you'd like for me to discuss in more detail, I can also do that as well. In talking about the survey that occurred in 2019, I'd really be interested in to see. Uh, I just my personal experience. I'm willing to bet that the numbers have increased since there's been so much stress with COVID, not only in dealing with everyday life, but just trying to get back to normalcy. Uh, there is still a stigma of asking for help. You know, we'd like to see more people asking for help in regards to mental health. So a lot of times students might self-medicate, and I see it even with middle school students. It's been 2 years, but some of the middle school students haven't acclimated themselves yet in a social in a social setting where you see teachers and students being very frustrated, not so much with the academic sense, but more the social sense. And a lot of students I do talk to, it takes months, even a half a semester to just even say that there's a problem. And a lot of times they do admit they do self-medicate. Um, and I can only imagine, you know, the number would be higher with college students since the stakes are that much higher. And so I'm really interested to see if the Caller Times will do a follow-up on that in a in a I don't want to say post-COVID because we're still dealing with it, but where it's not so dire, where you know more people have been vaccinated, and so we're not seeing as high numbers. But I think what we're seeing is more people, rather than dealing with COVID, they're dealing with the after effects of COVID. So it'd be interesting to see if they can follow up on that.
Right. I think it'd be interesting to see a lot of different types of statistics come from that.
Right. I mean, even in the professional setting, it's still an adjustment, you know, coming back to work and um, dealing with coworkers, clients who have lost, you know, family members, friends in with COVID. So yeah, it's still dealing with it.
Right. Okay. Well, then I'm going to go ahead and stop recording.